Mom, seriously, I'm trying to make a video. Can you give me 1 minute? Let's try this again. Hi, and welcome to the Spring Hill Equine Seminar. If you're new, like me, don't worry, it's gonna be fun. We'll give everyone a chance to grab some food and get comfy, and then we'll get started. Mom, I'm working here. You're always embarrassing me. Okay, I think we're about ready to go.
It's Dr. Carter. Keep a lookout for our next seminar, which will be on June 6th, about the challenges we face in the summer with our horses. Today we're going to be talking about equine metabolic disorders, which include Cushing's and equine metabolic syndrome, which I'll refer to as EMS. So to start off with, we'll talk about equine Cushing's disease. It's also known as pituitary pars intermedia dysfunction, or PPID. It's an age-related condition that leads to an enlarged pituitary gland. This enlarged pituitary gland secretes too much of a hormone, ACTH, and that results in the Cushing's disease. The most common sign that we see in horses that have Cushing's disease is a long hair coat that doesn't shed out well in the summer. And we call this hypertrichosis. They can also have patchy shedding or hair color changes, as you can see on the horse in the top right. They can also have muscle loss, most commonly on the top line. They can have retained guard hairs. They can have abnormal sweating, and more often it's a lack of sweating or anhidrosis, but they can have increased sweating. Sometimes they have lethargy or a change in their normal behavior. They can be struggling with chronic infections or desmitis and tendinitis. And they can also have hyperinsulinemia associated laminitis. So diagnosing Cushing's disease, we usually start with a baseline ACTH test, and that's just a blood draw. Occasionally, so the challenge with the ACTH blood test is that there's a seasonal variation. So most commonly we're wanting to test horses between January and June, because even normal horses will sometimes be high in the fall. It doesn't mean that we're not going to test in the fall. It just means that we might have to kind of look at the clinical signs of the horse and the value to determine if that's a true positive. That where we send off these lab work, they do give us different ranges depending on the season, so that's also very helpful. If we get a baseline test back and a horse has many of the clinical signs that we previously talked about, but their ACTH is normal, we may want to do a blood stimulation test with TRH, which is an injection. The one thing to note about that stimulation test is that we can't do it in the high seasonal variation time. So in the fall, we can't do the stim test, but it may be that we hold off and test that horse again in the early winter or summer. Treatment for Cushing's is primarily with the medication called Presend. This medication is available as a compound, but unfortunately it doesn't work, so we do have to use the brand name of the medication. Cabergoline is also available. The reason we don't primarily start with cabergoline is that it doesn't work well in all horses. It is an injectable, and we're often using cabergoline in horses that aren't tolerating Presend. And horses that don't tolerate Presend are usually showing signs of not wanting to eat well, and occasionally they can have diarrhea. When we're considering the diet of a horse with Cushing's disease, it really depends on what their body condition score is and whether or not they have insulin resistance. So for example, a horse with a normal body condition score and no underlying conditions, we're often feeding those horses, as a normal senior horse. On the other hand, if we have a horse that has a high body condition score, is obese and or has insulin resistance, those are the horses we're feeding very similar to horses on EMS type diets, and I'll go over that once we get to that section on EMS. So equine metabolic syndrome is primarily an issue with insulin dysregulation, and these horses kind of have a slow metabolism. So some of the signs of horses with a slow metabolism are general or regional adiposity, which that's fat deposits. In horses, these fat deposits primarily form on the crest of the horse, behind the shoulder of the horse, and around the tail head. And when there's the fat around the tail head, that's the easiest to tell because they kind of have the apple-shaped butt. Diagnosing EMS, we start with a baseline insulin test, and similar to Cushing's, if the insulin test is normal on baseline, but we have a lot of clinical signs and kind of history with that horse that it's that we're still suspicious that he has EMS, we'd recommend doing a blood stimulation test, and we do this by first drawing that baseline test, giving the horse a syringe of Caro syrup, waiting a little bit, and then pulling a second blood test. And that will tell us whether or not that horse has EMS. Treatment for this condition kind of varies. We primarily try to start with diet changes and exercise, but there's many medications available, including Thyro-L, metformin, and insulin-wise. Changing the diet of an EMS horse, we're often putting these horses on ration balancers, which provide vitamins and minerals without adding extra calories and sugar. Sometimes we're limiting the grass with a grazing muzzle because grass can be really high in sugar and affect their insulin that way, or we're putting them on dry lots to prevent them from having grass at all, depending on their sensitivity, and that really depends on each individual horse. So for forage, these are the horses that we're often putting on a lower quality hay, such as Coastal, with the caveat of anytime we're feeding Coastal, we're also giving a smaller amount of a legume hay, which would be like peanut or alfalfa hay, to lower our risk of colic when we're feeding Coastal hay.
There's some questions.
Okay.
What if you think your horse has EMS and blood work is normal for insulin Cushing's? Do you recommend the same precautions, and would you continue to check yearly blood work?
So the question was, if you think your horse has EMS or Cushing's and the blood tests are coming back normal, would I continue to do yearly treatment, and what would the precautions be?
Yearly blood work or
Yearly checks. I would definitely be checking those horses yearly. Depending on the clinical signs that they're showing, I would do the stimulation tests, both for Cushing's and the EMS. So the TRH stimulation test for Cushing's or the oral sugar test for EMS, because some horses can be like subclinical on that baseline test. And I always keep in mind that what we're testing for are hormones that naturally fluctuate throughout the day. So just because we draw blood and that snapshot of blood is normal, that doesn't necessarily mean that that horse is normal all the time. And also depending on their clinical signs, I might be checking them a little more frequently, especially if laminitis is involved, because a horse that has laminitis secondary to either EMS or Cushing's, it's really hard to manage the laminitis without managing the cause first, so either the Cushing's or the EMS.
And so you would recommend the same precautions even if the blood work's coming up normal, but you're worried your horse has metabolic syndrome, you would still treat them like they have metabolic syndrome?
Yeah, so I would treat them as if they had metabolic syndrome with the diet and exercise. I might not necessarily put them on medications to lower their insulin without definitively diagnosing the high insulin to like reduce some of the side effects of those medications.
Fallen crest, do you think that is genetic or a sign of equine metabolic syndrome?
The fallen crest being genetic or a sign of equine metabolic syndrome, I think it's a little bit of both, and EMS is a little bit of both. There can be environmental factors such as, a horse living on rich pasture and being fed like a high grain diet may develop EMS, but I also feel like genetically a lot of these horses and breeds are susceptible to EMS and developing that regional adiposity, and in extreme cases the fallen crest from that.
And then a final question, a Cushing's horse on 1.5%, when he's on a lot of grass for longer than 45 minutes, he gets a little belly achy.
Mm-hmm.
Would you recommend restricting him on his grass time?
Okay.
Because it restricts his exercise, so it's a little bit of
Okay. So the final question is a Cushing's horse that's on 1.5 tablets of Presend, and if he's on too much grass, he gets a little belly achy. So would I restrict his grass, because then it would restrict his exercise? I think, and I have a slide at the end where these metabolic diseases can get challenging because each horse is different. In that case, after looking at the horse, I'd be inclined to restrict his grass intake because he's belly aching on the grass. I don't necessarily think he's belly aching on the grass because he has Cushing's, but that individual horse isn't tolerating the grass very well. So I would either muzzle him to reduce, like grazing muzzle him to reduce his grass intake, or have him out on that grass pasture, and if he's in a situation where he could be in a larger dry lot so he could still get exercise and move around but not necessarily eating the grass, those would be my considerations for that case. All right, so we're all caught up on questions, and we just finished covering some of the diet recommendations for an EMS horse. And then they kind of beat me to it, but these endocrine diseases can get complicated. For one, a horse can have both Cushing's and equine metabolic syndrome. Some horses don't show like the classic signs of either disease. And in my experience, some of the harder cases can be, we'll have a horse with high insulin, and he has equine metabolic syndrome, and he has regional fat deposits, but then he is actually really thin and really lean. So a lean EMS horse I find to be really complicated. And then just adding in the medications that we use to treat the horses. Not all horses tolerate the medications. So it can get complicated quickly. And with that being said, touching base with your veterinarian and kind of providing a good history of what you've noticed with your horse and what you're feeding your horse and kind of how they've changed over the years. And then having your vet do a good exam on your horse and then blood testing to see what's going on with your horse so we can pick the best treatment, and then following up with rechecks with the blood work and kind of clinical signs to make sure that the treatment that we've implemented is, managing their conditions appropriately. And then if there's any other questions, I'd be happy to answer those.
Are there any feeds you should avoid when you have a horse that's got EMS or Cushing's?
Feeds to avoid if they have EMS or Cushing's. So it's kind of one of those challenging, it depends. Because horses that have EMS, I'm often, for them, avoiding complete feeds because they tend to have extra calories that some horses need, but in a textbook perfect world, EMS horses don't necessarily need extra calories. And similarly with Cushing's, a horse with just Cushing's that otherwise has a normal body condition score, I'd be feeding them kind of to their level of exercise and whether or not they're an easy keeper. So I wouldn't necessarily say I'm avoiding feeds with them. It's a very I feel like endocrine diseases can get are a very individualized treatment regimen because not every horse is a little bit different.
I have a question. What is a fallen crest?
I'll go back a few slides. A fallen crest is this top right, the gray horse in this top right picture has a fallen crest. You can see in this first picture, this where I'm following with the mouse, if they can see that, is regional adiposity at the crest. And this horse has it too, but it's become so large that it started to like roll over, and that's a fallen crest.
How do you weigh the balance between having a grazing muzzle on and but still able to eat versus being able to move around and get that exercise?
The question was, how do you balance having a grazing muzzle on as well as getting them exercise? It kind of depends on the horse, but generally, if a horse is sensitive to the grass, like an equine metabolic horse, and we want to limit his intake of grass, usually we want him in a grazing muzzle for the entire time he's on grass, because we've had, there's been a study that basically showed a horse, once we take, for example, if they're outside all the time or like 12 hours on a pasture, if we were to do 6 hours with the grazing muzzle and 6 hours without, a horse would catch up in those 6 hours without the grazing muzzle and basically make up for any time that he was actually muzzled. So that can be the kind of challenging approach to grazing muzzles, is they do need to be on it most of the time that they're on grass. And then with exercise, horses can't exercise and roam out in the pasture with a grazing muzzle. What I sometimes do with retired horses that may not necessarily be ridden anymore or may have lameness issues is take them for like senior power walks around the property. And so like for 10-15 minutes, just kind of power walk with your horse the best you guys can to just get them moving and get them walking. Because horses can develop like sedentary habits and not, walk with a purpose out in the field on their own. So if, depending on their other conditions, if they're able to take power walks a few times a week, I think that can help with the exercise, whether or not they have a grazing muzzle as well.
All right. Is a crest on the mule the same problem as on a horse?
The question is the crest on a mule the same as the crest on the horse? And so mules and donkeys also have those regional fat deposits as horses do. Donkeys and mules, donkeys primarily are like desert type equids, so they have a higher predisposition to really develop those fat deposits. And they tend to also kind of put regional fat deposits along their back, kind of unique to them, but it is the same kind of condition, and we do see donkeys that have equine metabolic syndrome just like horses.
What types of pasture, grass height, or turnout times are best? There's a lot of conflicting information on the internet about how to manage grazing.
So the next question is how to manage pasture height with horses with EMS and like time of day. So when we're thinking about time of day and grass and like sugar content in regards to our horses that have sensitivities to sugar, basically the grass is making more sugar the more the light is on the grass. So during the day, the grass is gradually increasing the amount of grass. So the best time to turn them out would be in the beginning part of the day before the grass has had time to create a bunch of sugar with photosynthesis. And then with grass height, I don't have the measurements of the grass height off the top of my head, but if we cut the grass really short and stress the grass, it also creates more sugar. So we don't necessarily want to mow our lawn like weekly or very frequently to try to, sometimes you can think I'm cutting the grass short, so I'm limiting the amount of grass that they can eat so they won't get more sugar from it. But it's actually the opposite. The more we cut it short, the more stress the grass gets and the more sugar it's producing. So you kind of want to let the grass grow, and I don't know the height off the top of my head. But basically you don't want to have them graze on frequently mowed grass.
All right. If you're bringing a horse onto a new pasture with a lot of grass, should you restrict their time in that pasture?
If you're bringing a new horse into a new pasture on grass, I usually, with a lot of grass, if they're not used to it, I usually try to do like an introductory period, just like any hay or grain that I feed them over 10 to 14 days. Anytime you drastically change a horse's diet, you can predispose them to colic. And I think that would be with any horse, not necessarily one with an endocrine disease.
All right, I think that's it. We can wrap it up.
Okay, cool.
Say thank you, everybody.
Thank you, everybody.